I lived most of my life, and I've always like had like tight hips, and I was just like, you know, it's just because I don't stretch and I don't do yoga. And once I turned like 40, 41, I was like, God, I'm having hip issues. And I went to see a doctor, and I was told, you know, I was probably a candidate for hip replacement at some point, which of course just like floored me at 40, 41. I'm like, you got to be kidding me. That's something that like people who are a lot older than me would have done. You know, finally it just got to the point last year where I couldn't windsurf, I couldn't ski, I couldn't really do anything anymore. And I was 49 years old. And, you know, at some point, do you want to be crippled at 49, or do you want to continue to live your active lifestyle? And so let's do it. You know, I'm skiing better than I have in 20 years. I'm windsurfing better than I have in 20 years, and it's only been 9 months since the surgery. So, I mean, it's pretty amazing. And there's like this tiny little scar. I mean, it's almost gone. So I think, you know, Dr. Mast's procedure of this sort of the anterior approach, I understand now why he's been advocating it for so long, just because the recovery is so quickly. He's not really going through so much tissue, and it's such a quick recovery. You get back to what you love doing really quickly. Dr. Mast has been telling me for so long, you'll know when it's time. And really the ideal time to have the surgery is when you get to a point where, you know, you just can't do anything anymore. And it was literally a month before the surgery. I couldn't windsurf anymore. Anything that involved, you know, splitting your hips in any sort of way was just becoming impossible. I would say a trip to the dentist to get a tooth filled is more painful and more discomfort than having my hip replaced. I went in, the folks at the surgery center were great. You know, Dr. Mast was just like put me at ease in the morning. I was in there at 7:30 in the morning, and at 11 o'clock in the morning, my eyes opened up and it was over. And, you know, the next morning I walked out of there. I used the crutches to get out of the facility, and I never used them again. I had the cane for about 4 days, and I was on painkillers more as a preventative measure for about 4 days. And after about a week, I was completely off the painkillers. I was taking, you know, ibuprofen and anti-inflammatories just as a matter of course, but I was not suffering any pain at all post-surgery. Right now, I'm 9 months post-surgery. I skied 10 days this winter, starting at 6 months, literally to the day, 6 months after the surgery. Day 2 was powder up to here, and I had no issues, no residual pain or soreness or anything. And I've been out windsurfing already this year, so you know, so far it's been a pretty good recovery, pretty positive. I mean, thumbs up right now, you know.